We are here at Deuk Spine Institute. Our patient has back pain coming from her sacroiliac joint. Sacroiliac joint pain is a very common cause of back pain. What we're going to do today is go in and try to destroy the pain nerves to the joint. These are sensory nerves. Their only purpose is to basically cause pain when your sacroiliac joint has inflammation in it. We want to end her pain so that she doesn't have that pain anymore. Sean? To do that, I have to go inside the joint and destroy the 5 pain nerves. Okay, Jordan. While I'm talking to Jordan and getting ready, why don't you show the audience how sacroiliac joint pain comes from inflammation and arthritis in the joint.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Welcome back. You can see from our animation that the SI joint has basically the ability to become damaged, and once damaged, want me to wait a minute? Once it's damaged from trauma, like a car accident or a fall, the joint has a torn capsule, which then over time causes arthritis to set into the joint, which is inflammation. That inflammation ends up destroying the joint through an arthritic process. And patients end up having horrible pain that comes from the SI joint. That pain never goes away, and it just plagues the patients every day. It can be incredibly debilitating pain. Shot? Let me know when you're ready. Take your time. So, doctors have been treating sacroiliac joint pain with a variety of treatments over the years. It started with injections, usually a steroid injection, to reduce the inflammation. That would give patients a few weeks or a few months of relief, and then the pain was back. We figured out that injections were not going to solve the problem. So somebody developed what's called a fusion of the joint, and by fusing the joint, they were hoping to get rid of the pain. Fusions are very invasive, they're very painful, they take a long time to recover from, and what I found is they don't work. We used to do them, and our patients never got any better. So we stopped doing SI joint fusions. Shot? Wow, she has a very deep joint. Can I proceed? Yes. Shot? So there's a deep part of the joint, that's where I am right now, and that's where her pain is coming from, this deep part. And there's also a superficial part of the joint, which is a part of the joint that's, let me have it, that's just close to the surface. She has definitely deep pain, and so we have to go to the deep part of the joint to treat it. How's blood pressure? Shot? Any questions? Any questions from the audience?
No questions at this time.
All right. I'm going to just give it a second here. We have a little bit of venous oozing. I want to stop that, and then we're going to finish up and we'll be done. So we've already shown the video on how the sacroiliac joint can be so painful, correct?
That is
and
correct.
how we treat it. Shot? All right, good. And Jordan, just while we're waiting here for a moment, show the audience. Actually, let me just put this here. Show the audience, get a quick picture and show them the SI joint. So there's the bottom of the SI joint. As you come up, the joint goes all the way up to the top right there. And if you've been watching, we've been destroying the pain nerves and focusing more at the top of the joint, because that's where most of her pain was. Shot? Yep. The top half of the joint. And I'll tell you, she has a very deep joint. This is probably the deepest one I've ever done. All right. I think we got it. I've done as much as I can. Any questions?
No questions.
All right. Let's go ahead and end the stream. We'll be back shortly with the next patient who has pain coming from a disc injury in his back. He has 3 discs that are causing back pain. 2 of them are pinching the nerves on both sides of the spine. We're going to go in and treat that with our Deuk laser disc repair, laser spine surgery. You can see the incision for the SI treatment is very small. It's only about 5 millimeters. Thanks for joining us. You can end the stream.